In the previous lecture we discussed about the general classification of antihypertensive drugs. Today, we will talk about the diuretics in detail. Before starting, do like the video, and subscribe the channel. Coming on to the topic diuretics, these are the drugs cause loss of sodium and water in urine. Diuretics are classified into the loop diuretics and the thiazide diuretics. Loop diuretics act on the loop of Henle to inhibit sodium, potassium and chloride reabsorption. These are the short-acting and of short duration. Therefore they are not used in routine in hypertension except in presence of renal or cardiac arrest. They include the drugs like furosemide and bumetanide. Now, talking about the thiazide diuretics. They have weak action and are long-acting, therefore they are used in uncomplicated mild to moderate hypertension. They should be administered in low dose, that is 12.5 mg of chlorthalidone or hydrochlorothiazide. If the antihypertensive response is not adequate, dose can be increased to 25 mg per day. But beyond this dose is not safe. Mechanism of action of thiazide. They directly inhibit sodium and chloride symport in the early part of DCT. By this no sodium and chloride return to the blood. And promote sodium and water excretion. By which blood volume decreases. Leading to decrease in cardiac output and blood pressure. They include the drugs like chlorothiazide, hydrochlorothiazide and chlorthalidone. Adverse effects of thiazides include hypokalemia, that is decrease in potassium. Hyponatremia. Metaboli. Acidosis and so on. Main difference between loop diuretics and thiazide is that loop diuretics cause decrease in calcium while thiazide cause increase in calcium. Now we will discuss renin-angiotensin-aldosterone system, RAAS inhibitors. Understanding the physiology of RAAS system. Kidneys secrete the hormone called renin, which help in the conversion of angiotensinogen into the angiotensin 1, and the ACE angiotensin converting enzyme from the liver convert angiotensin 1 to the angiotensin 2, which act on the angiotensin receptors mainly at 1. Acts on the blood vessels, causing vasoconstriction and increase in total peripheral resistance, resulting in increase in blood pressure. It also causes increase in sodium and water retention, by which blood pressure increases. Aldosterone can also cause left ventricular hypertrophy, which can cause death. Also increase the sympathetic release. So we inhibit this RAAS system because it increases blood pressure. Now there are multiple drugs which block this system at different points, resulting in decreased blood pressure. We will discuss about them in the next lecture. Till then, keep sharing these videos with your medico friends and do subscribe the channel. Take care.